Let me share with you the 12 most common reasons why people get numbness in their hands and feet. Numbness happens when nerves aren't working right. Your nerves are like messengers that carry signals between your body and brain. When something interferes with these messages, you feel that strange tingling or loss of feeling. This feeling is very common. But when it happens often, it might point to something that needs attention. Studies show that as we age, we're more likely to experience numbness. While about 13.7% of all people experience numbness, this increases to about 30% in people over 75 years old. The problem affects both men and women, with slightly more women reporting symptoms according to some studies. Number 1. Vitamin deficiencies. Your body needs various vitamins to keep your nerves healthy. When you don't get enough of certain vitamins, especially B vitamins, your nerves can start to have problems. Vitamin B1, B6, B12, and folic acid are particularly important for nerve health. People who don't eat a balanced diet might develop vitamin deficiencies. Certain medical conditions can also make it hard for your body to absorb these vitamins. Just a regular multivitamin may not help. I take a vitamin B complex since I had a similar issue a few years back. Low potassium, calcium, or sodium levels can also contribute to numbness. Numbness caused by vitamin deficiencies can often be fixed by taking supplements and improving your diet. But it's important to find out exactly which vitamins you're lacking before starting any supplements. Your doctor can do simple blood tests to check your vitamin levels. Number 2. Excess alcohol consumption. Drinking too much alcohol over a long period can damage your nerves. Alcohol is actually a toxin that can hurt nerve tissue. This can lead to a condition called alcoholic neuropathy, which causes pain and tingling in your hands and feet. Studies show that up to 66% of long-term alcoholics experience this type of nerve damage. The alcohol damages the peripheral nerves, causing them to send incorrect signals to your brain. Treatment focuses on stopping or reducing alcohol consumption. Nutritional supplements might also help, as alcoholism often leads to vitamin deficiencies that make nerve damage worse. Number 3. Injuries to nerves. Physical injuries can damage your nerves and lead to numbness. This includes things like traumatic injuries from accidents, repetitive stress injuries from doing the same motion over and over, or compression injuries where something presses on a nerve for a long time. For example, a neck injury might cause numbness anywhere along your arm or hand. A lower back injury could cause numbness along your leg or foot. People who do repetitive motions for work, like typing all day or using vibrating tools, might develop nerve damage over time. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Recovery depends on how severe the damage is. Minor injuries might heal on their own with rest. More serious injuries might need physical therapy, medication, or even surgery. But some nerve damage can be permanent, especially if it's not treated quickly. Number 4. Exposure to other toxins. Besides alcohol, other toxins can damage your nerves and cause numbness. These include heavy metals like arsenic, mercury, and lead. Other harmful substances, like certain chemicals or even some medications, can also harm your nerves. You might be exposed to these toxins through your work, contaminated food or water, or even some consumer products. The symptoms can develop slowly over time as the toxin builds up in your body. If toxin exposure is causing your numbness, treatment needs to happen quickly. The specific treatment depends on the type of toxin involved. It might include removing the source of exposure, medications to help your body get rid of the toxin, or care while your body heals. Number 5. Diabetes and nerve disease or neuropathy. Diabetes is one of the biggest causes of nerve damage and numbness. It accounts for about 30% of all peripheral neuropathy cases. About 2/3 of people with diabetes develop some form of nerve damage. There is a separate video about diabetes-related peripheral neuropathy in the link up above. When you have diabetes, high blood sugar levels can damage your nerves over time. Doctors call this diabetic neuropathy. The numbness and tingling often start in both feet, then move up the legs. Later, it might affect both hands and move up the arms. If you have diabetes, controlling your blood sugar levels is really important to prevent or slow down nerve damage. But once nerves are damaged, the effects might be permanent. That's why it's so crucial to manage diabetes well from the beginning. Neuropathy is a general term for diseases that damage nerves. There are more than 100 types of peripheral neuropathy. This condition affects about 1 to 3% of the general population, but increases to 7% in people over 65 years old. When you have neuropathy, the damaged nerves can't send signals properly. This leads to numbness, tingling, and often pain in your hands and feet. The symptoms usually start at the tips of your fingers or toes and spread inward. Number 6. Poor blood supply. Your nerves need a good blood supply to function properly. When blood flow is reduced to an area of your body, the nerves there might not get enough oxygen and nutrients. This can cause numbness and tingling. Poor blood flow can happen because of conditions like hardening of the arteries, peripheral artery disease, or Raynaud's phenomenon. During a stroke or mini-stroke, reduced blood flow to the brain can cause numbness in parts of the body. Treatments focus on improving blood flow. This might include medications to widen blood vessels, prevent blood clots, or control underlying conditions like high blood pressure. Lifestyle changes like quitting smoking, exercising regularly, and eating a heart-healthy diet can also help improve circulation. Number 7. Exposure to other toxins. Besides alcohol, other toxins can damage your nerves and cause numbness. These include heavy metals like arsenic, mercury, and lead. Other harmful substances, like certain chemicals or even some medications, can also harm your nerves. You might be exposed to these toxins through your work, contaminated food or water, or even some consumer products. The symptoms can develop slowly over time as the toxin builds up in your body. If toxin exposure is causing your numbness, treatment needs to happen quickly. The specific treatment depends on the type of toxin involved. It might include removing the source of exposure, medications to help your body get rid of the toxin, or care while your body heals. Number 8. Staying in one position too long. We've all felt our foot or hand fall asleep after sitting or lying in an awkward position. This happens because staying still puts pressure on your nerves. The pressure blocks normal nerve signals to your brain. When you sit with your legs crossed for a long time, you might feel numbness in your feet. The same thing happens if you lean on your elbow or arm for too long. Your hand might feel tingly or numb. The good news is this type of numbness usually goes away quickly once you change position. The feeling returns as your nerves start working normally again. But if you often sit or stand in the same position for hours, like at a desk job, you might feel this numbness more frequently. Number 9. Pinched nerves. Sometimes a nerve gets squeezed or compressed somewhere along its path. Doctors call this a pinched nerve. It can happen in your back, neck, wrists, or elbows. When a nerve is pinched, it can't send signals properly. This leads to numbness in the area that nerve connects to, often your hands or feet. For example, a pinched nerve in your back might cause numbness in your feet. A pinched nerve in your neck could make your hands tingle. Pinched nerves can happen because of injuries, swollen tissues, or even sleeping in a bad position. You might also feel pain along with the numbness. Your movement might be limited too. Treatment usually involves rest, pain medicine, and physical therapy exercises. But some people need surgery if other treatments don't help. Number 10. Carpal tunnel syndrome. Carpal tunnel syndrome happens when the median nerve, which runs from your forearm into your hand, gets compressed at the wrist. This leads to numbness, tingling, and sometimes pain in the hand and fingers. This condition is common among people who do repetitive hand movements, like typing, assembly line work, or certain sports. It can also be associated with pregnancy, diabetes, thyroid disorders, and rheumatoid arthritis. If you have carpal tunnel syndrome, you might notice the numbness is worse at night or when you first wake up. You might also drop things more often or have weakness in your hand. Treatment options include wrist splints, avoiding activities that make symptoms worse, steroid injections, or surgery in severe cases. Number 11. Inflammation of nerves. Sometimes our nerves get inflamed or irritated. Doctors call this neuritis. When nerves are inflamed, they don't work properly. This can cause numbness, tingling, and sometimes pain in your hands and feet. Nerve inflammation can happen for many reasons. It might be from an injury, an infection, or even from your immune system attacking your nerves by mistake. The feeling of numbness might come and go, or it might stay constant. The treatment depends on what's causing the inflammation. It could include medicine to reduce inflammation, pain relievers, or treatments for the underlying condition. Number 12. Other medical conditions. Conditions like peripheral vascular disease or Raynaud's phenomenon can restrict blood flow to the extremities, causing numbness. Diabetes, multiple sclerosis, hypothyroidism, and certain autoimmune diseases can also lead to numbness. Medications and toxins. Some medications, especially chemotherapy, and exposure to toxins like lead or alcohol can cause nerve damage and numbness. The treatment depends on what's causing the nerve damage. It might include medications for pain, physical therapy, or treatments for underlying conditions. But some nerve damage can be reversed. In these cases, treatment focuses on preventing further damage and managing symptoms. Occasional numbness that goes away quickly isn't usually a cause for concern. But you should see a doctor if your numbness happens often or lasts a long time, gets worse over time, affects your daily activities, comes with weakness, pain, or other symptoms, starts suddenly after an injury. Sudden numbness on one side of your body, especially with confusion, trouble speaking, or a severe headache, could be a sign of a stroke. This is a medical emergency, and you need to get help right away. Taking care of your nerves. Even if you're already experiencing numbness, there are things you can do to help. Take breaks if you do repetitive activities. Change positions often when sitting or standing for long periods. Eat a balanced diet rich in B vitamins. Limit alcohol consumption. Don't smoke. Exercise regularly to improve circulation. Manage conditions like diabetes carefully. Numbness in your hands and feet is often a sign that something isn't right with your nerves. By understanding the possible causes, you can take steps to address the problem. But don't try to diagnose yourself. Talk to your doctor if you have ongoing numbness. They can help find the cause and recommend the best treatment for you. Your quality of life can be affected by numbness. A study found that as numbness intensity increases, quality of life decreases significantly. This was true for numbness in both hands and feet. But with proper diagnosis and treatment, many people find relief and can return to their normal activities. Remember that each person's experience with numbness is unique. What works for one person might not work for another. Work with your healthcare provider to find the approach that's best for you. Do not forget to click the like button and subscribe. On the screen, this video about diabetes peripheral neuropathy is a must-watch. Thanks very much for watching this video. See you in the next video.